Good morning. Today we're going to do, my name's Susan, the home health aide and LVN supervisor. Today we're going to do maintaining confidentiality. And if you go ahead and open your books, I'm going to go ahead to some of the more important areas. Some of them are stories and things like that that we're going to skip, but I'm going to go to some of the other ones that we've read about and that I know will be perfect for this situation. So if you go to page 2, what exactly is confidentiality? As a healthcare worker, you are trusted each day with confidential information about your clients. As a nursing assistant, you spend more time with your clients than anyone else on the healthcare team. This helps you develop a close relationship with your clients. Your clients feel safe telling you personal details about their lives and their health because they know you will keep it to yourself. Now, be honest. Have you ever discussed a client's private information with your family or laughed about a client with a group of coworkers? Most healthcare workers will probably answer yes. Unfortunately, it is easy to break confidentiality if you're not careful. So what exactly is confidentiality? Confidentiality means that your clients and your coworkers expect you to keep their personal information to yourself, and you will expect the same for them. You guard information about your clients all the time, even in the privacy of your own home. When you keep personal information safe, your clients come to trust you. This trust is an important part of your relationship with your clients. Healthcare organizations must promise clients that their medical information will be kept safe. This promise is included in the patient's Bill of Rights in all healthcare facilities. Be sure you understand the patient's Bill of Rights where you work. Confidentiality versus privacy. It is easy to confuse confidentiality and privacy. They are very similar, but confidentiality usually applies to medical records and ensuring that information is available only to those who are allowed to see it. For example, maintaining your client's confidentiality involves keeping their medical records away from anyone who does not have the right to see them, and never discussing their diagnosis with someone who is not part of their healthcare team. Maintaining your client's privacy has to do with things like not touching their personal possessions, not listening to their private conversations with others, and not entering their rooms or personal space without their permission. On the right-hand side, under key terms, informed consent is when a resident or client acknowledges and allows the release of information to other parties. This permission is given by filling out a legal consent form, which becomes part of the resident's or client's permanent record. Private healthcare information should be available only on the need-to-know basis. This means that each person on the care team should only have access to information that he or she needs to know to carry out the care plan. Okay. On page 3, under how confidentiality is broken, how about we go to talking to coworkers. During a lunch break with 5 other nursing assistants, Jim told a story about his client, Mr. Smith. Jim said Mr. Smith was very forgetful and kept trying to eat his dinner with a toothbrush instead of with a fork. The whole group laughed. The whole group laughed at Jim's story. Even if it is like a harmless story, avoid discussing your clients with other employees unless they are part of the client's healthcare team, and then do it in private, not at lunch. If Mr. Smith were your father, would you want a bunch of people laughing at him? True. All right, let's go to page 5. At the bottom, then came high tech. In 2009, the Department of Health and Human Services introduced the Health Information Technology for Economic and Clinical Health, HITECH it's called, Act. And this act gives HIPAA more teeth. HITECH significantly increases the fines that may be issued for violations of the HIPAA rules and encourages quick and decisive actions. Prior to HITECH, fines were limited to $100 for each violation or $25,000 for all identical violations. Now there are tiered ranges and fines with a maximum penalty of $1.5 million and potential jail time. In addition, individuals who violate privacy laws can no longer claim they didn't know a violation occurred. That's huge. Okay, under page 6, exceptions to confidentiality. I'm going to read that. Did you know there are times when you are not required to keep a client's information confidential? Here are some examples of when you should share information. You are caring for a client, Mrs. Adams. A doctor or nurse who has been treating your client asks for information about Mrs. Adams. You are allowed to share this information with another healthcare provider who is treating your client. Your client, Mr. Johnson, has bruises that he did not have the day before. He had no injury that you know about, and when you ask him about it, Mr. Johnson gives you a suspicious reason for his injury. If you suspect your client is being abused, you should report it to your supervisor or the authorities. You are working in a nursing home caring for Mr. Sanders, a client with dementia. One day, Mr. Sanders has an argument with another client and you hear him threaten to hit the client. If a client physically threatens to harm you, himself, or anyone else, you should report it to your supervisor. Your client, Mrs. Robinson, has been attempting to drive a car when she is unfit to drive. If your client is a danger to others, you should report it to your supervisor. You have a client, Mr. Anderson, who is having chest pains. In an emergency, you are allowed to share confidential information about your client with emergency personnel. You should report this to your supervisor and follow emergency procedures for your workplace. And I know many of you have been there when we've had to call 911 on a patient and you've been able to give information to the paramedics, which is exactly what you're supposed to do. Okay, let's go to the next page, page 7. Think about it. What you don't know. Do you know, do you think you should be told if a client is HIV positive? Do you believe that you have the right to know this bit of private information, especially since you might be providing personal care to this person?
Yes.
Well, the answer is no.
What?
You don't have the right to know if a particular client is HIV positive. As healthcare workers, we protect ourselves from contagious diseases like AIDS by using standard precautions with every client. By treating all your clients as if they may have an infectious disease, you can protect yourself without knowing this particular client's HIV status. Confidential documentation. Which of the following do you think qualifies as confidential documentation? A client's medical record, your client care note, a bulletin board listing the client and his or her diagnosis, the result of a coworker's TB test, your annual job evaluation, a client's address and telephone number, a copy of the doctor's order? Well, the answer is they all are. All personal information about you, your clients, your coworkers should be kept confidential. This means keeping medical records and personnel files in locked cabinets, locked rooms, or supervised areas. Confidentially speaking. Remember to be careful when you're talking about your clients. Before speaking, ask yourself, is what I have to say confidential information? Is the person I'm speaking to part of the client's healthcare team? Am I in a private area, or are there other people around me who shouldn't hear what I'm saying? I am sharing this information for the client's benefit, or is this just gossip? What would you do if the following people asked you for information about your client? Friends, partners, family members. The answer is the same for all. Politely ask them to speak to your supervisor. Just being a part of, being a family member, partner, or friend does not give someone the right to have information about your client. You can just have them call into our call center where they'll see if that person is on the list of somebody to receive information. You don't have to retract it. Let's do, we're almost done, I think. Yeah, let's just do a couple more things. 5 key points on page 9. Review what you've learned. Confidentiality involves keeping clients' medical information away from anyone who does not have the right to know it. HIPAA is a law which outlines the privacy rules that protects clients' medical records and information. Your client feels safe telling you personal details about their lives and their health. They trust you that you will keep it to yourself. Healthcare workers who breach confidentiality can be fined, lose their license, and even be put in jail. Your client's medical information is something they own. You wouldn't take a client's clothes and pass them around to other people, so don't pass around the client's private information either. That's well said, right? Mm-hmm. So let's go back, let's see, the page 10. I'm just going to pick out a few bullet points. Be aware of who is around you, whether you speak about a client. Remember that you are responsible for what you say, and the healthcare workers have been sued for saying the wrong thing at the wrong time. Think of your client's medical information as something they own. I already just read that. Be careful if you use a cellular telephone during the workday. When you talk on your cell phone, your conversation might be picked up by strangers. Never give a client's full name or address over a cellular telephone. Never leaving charts, papers, computer screens containing client information visible in public areas. Others may be able to see them. If you work at a facility, avoid talking about clients in public areas, like the cafeteria or the front desk. You never know who may be able to hear you. After viewing client information on a computer, don't leave without logging off the computer first. Also, don't share computer passwords or codes with anyone. Always be careful with what you say. For example, Tom was late with the client's bath and said, "Sorry, I would have been here sooner, but Mr. Smith had diarrhea, and I had to clean him all over again." Tom broke confidentiality by talking about Mr. Smith to another client. It's important for you to share confidential information with your supervisor if it involves a client's health or well-being. For example, if a client tells you that the right side of his body has gone numb, you do not keep that information secret. Let your supervisor know right away. Okay. So let's go ahead and go to the test. Make sure you put your name and date on it and your signature. Okay. Number 1. Clients have the right to confidentiality as stated in A, the Privacy Practice Act, B, the Patient's Bill of Confidentiality, C, the Bill of Rights, or D, Insurance Agreement Act.
A.
Nope.
Is B?
Nope. You can go down the whole line?
C.
Lillian, yes, it's C. The Patient's Bill of Rights. Healthcare organizations must promise clients that their medical information will be kept safe. This promise includes the Patient's Bill of Rights in all healthcare facilities. Okay, number 2. Someone who breaches confidentiality may be D. They'll be fired, put in jail, and fined. So it's D. Your client is complaining of chest pains. You call 911 on his behalf. The operator begins asking you questions about the medical history. You should A, hang up and have the supervisor make the call. B, provide the information because it's an emergency situation. C, put the client on the phone or give give consent for you to speak for them. Or D, politely refuse to provide your client's personal health information.
B.
B,
Yeah.
provide the information because it's an emergency situation. Number 4, the best place to discuss your clients with coworkers is in the hallway, in the cafeteria, in a private room with the door closed, or an employee break room.
C.
C, you're right, in a private room with the door closed. The only safe place to discuss private health information is in a private place where others cannot hear what you are saying. Okay, breach of confidentiality is when a client acknowledges and allows the release of information to other parties. True or false?
True.
Breach of confidentiality is when a client acknowledges and allows the release of information to other parties.
It's true.
It's false.
Oh, really?
Because if the patient allows you to release the information, it's not a breach of confidentiality because they're allowing it.
it
So
says
it's
false.
false.
Okay.
Informed consent is when a client acknowledges and allows breach of confidentiality. Okay, yeah, it's not true. It's false. Yeah,
Okay.
because informed consent is
Mhm.
when a client acknowledges and allows the release of information to other parties.
Okay.
You don't have the right to know if a particular client has HIV. True.
It's true.
You don't have the right to know if a particular client is HIV positive. By treating all your clients as if they might have an infectious disease, you can protect yourself without knowing the particular client's HIV status. Number 7, it's okay to discuss your client's health status with people who are directly involved in the client's care.
It's true.
True. Number 8, the High-Tech Act of 2009 decreased the fines and penalties for HIPAA violations.
It's a false. It increased.
That's right, they increased it, false, to crazy numbers.
Yeah.
If you use a computer to chart, you should always log off before leaving the computer.
It's true.
It's true. And a copy of the client's care plan is considered confidential information. True or false?
It's true.
True. So make sure you fill that out, sign it, date it, the picture on the back.